What have been some of the patient care outcomes that you've seen improved by this? Do you have any examples you can share?
Again, it's anecdotal. We're working on a paper
Mhm.
actively, and that takes a little bit longer. But I can give you, we asked very quickly after we started this, can you give us some examples where this is making an impact to our ED social workers? And they gave us like 15 or so examples. And pretty much all of them were around domestic violence, domestic abuse. And I think my takeaway from this is that they were not able to really identify this. This is a very tricky thing to identify.
Yeah.
And as a result of this insight being from any note that existed in the past 6 months, these things were getting picked up where they wouldn't have otherwise picked it up. And so there was one example where there was a 20 to 30-year-old female, and she came in with very non-specific complaints. I think she had a headache. She was not feeling well. She was just something that would have flown under the radar. They would have probably in the ED, they probably would have given her some Tylenol, some ibuprofen, maybe some fluids, and all the labs would have been fine and she would have been sent on her way. And this got triggered. And so the ED social workers, they found the exact note very quickly where it identified that this patient had some issues with domestic violence in the past and had come essentially to the ED previously where this was elicited. And so the ED social worker understood the situation and she was able to use essentially a trauma informed approach when she went to the patient, which is a specific way of kind of eliciting information backed by literature. And so she was able to go essentially to this patient, elicit more information than she would have if she had gone in without understanding this. And she was able to kind of understand what the situation was. And the ED visit was really tied to essentially that domestic abuse kind of instance. And she was able to kind of target specific resources that the patient could take away.